So
Okay.
first of all, I want to introduce myself. I am Arjun Chatterjee, one of the internal medicine residents at Cleveland Clinic main campus, and I would ask Dr. Abhishek Bhardwaj to introduce himself.
Well, thanks, Arjun. First of all, thanks for inviting me to do this. I think this is important, especially from one IMG to another. Some of the discussion we will have probably will resonate with a lot of students who are in transition or residents who are in transition as well. So thank you for doing this. So my name is Abhishek, and I grew up in India. I did my med school from 2004 to 2010 at KMC Manipal. I came to US for three electives. I did an elective in Boston at Harvard Medical School, Beth Israel Deaconess Medical Center. I did another rotation at Temple University in Philadelphia and another one in University of Cincinnati. Those three experiences really helped me with my decision of coming to the US for residency. I did my residency at a community hospital in Philadelphia, Mercy Catholic Medical Center, affiliated with Drexel University. And after that, I worked for 5 years as a critical care hospitalist at University of Pennsylvania at Penn Presbyterian Medical Center. I was a critical care hospitalist there. And during the same time, I found my research mentor, and I did a cardiac arrest resuscitation fellowship at Penn Center for Resuscitation Science. My goal was always to be a pulmonologist and an intensivist. So I applied for fellowship, and I did my pulmonary critical care medicine fellowship at Cleveland Clinic. And I graduated 20 days ago. And that's where Arjun and I met when Arjun was a visiting medical student from India. And now he is a all-star resident at Cleveland Clinic. So thank you for inviting me to talk to you.
Yes, I think we planned this almost a year back after I was fortunate enough to match into Cleveland Clinic. The main purpose of this being like kind of how you guided me through my journey, and then if we can lay out some basic principles and what kind of things like IMGs should be doing. One thing which I wanted to bring up to the viewers is, although I knew Dr. Bhardwaj from before, like I met him, he was working in a different unit. And when I came here as a medical student to Cleveland Clinic main campus, and I was in the ICU, he fortunately took my interview, and he really liked me as an interviewer and vouched for me. And I eventually ended up matching into Cleveland Clinic. So that being said, Dr. Bhardwaj was a part of the House Staffship Association at the Cleveland Clinic main campus. And he went through the interviewing process and kind of knows the inside secrets when it comes to interviewing and how that process works. So that's also going to be something which we're going to focus on. So to start this on a positive note, I would say residency application is coming up. A lot of people have applied, submitted their ERAS, are going to submit pretty soon. So what kind of things would you like look for in CV?
So Arjun, I'll tell you that there are no hidden secrets about the residency application, to be honest. It's a very fair, very rigorous process. There is a committee that's devoted to getting the brightest and the smartest and the most hardworking people in the program. And that's not just at one program. And I'm not going to speak for one specific institute. I can tell you that I was part of the GME during my residency program as well. So the process is fair in the best way possible, especially for international medical graduate. I can tell you that one of the most important criteria is your score, because and it's fair. I would say it's fair, and there are no two ways about it, that we have to have some objective criteria to select the candidates. There are limited spots, and thousands of applicants for those spots. So the criteria are relatively straightforward. It's your USMLE scores, it's your quality of letter of recommendation, it's your clinical experience in the US. And it's not just the number, it's the quality of your experience. So when you do an away elective as an international medical graduate, your preceptors, your mentors, they observe you over those 4 weeks, and then they vouch for you. And if you are outstanding, if you are diligent, if you are truly a kind, caring physician, and they can see you as colleagues, then they do specify that in their letter of recommendation. So we do carry a lot of, we do put in a lot of weight for the letters of recommendations. The personal statement are important, and you should not think that you can write a personal statement over the last 7 days or 10 days. You should spend time. It's very hard to talk about yourself in a positive light without coming across as someone who's obnoxious and full of themselves. So it's a very self. Let me rephrase that. It's an enlightening experience where you need to truly define yourself as a person on a piece of paper. You don't want it to be multiple pages long. You need to be clear. You need to be thoughtful about what you want to add. So your personal statement carries weight. One advice about the personal statement is that start early, and it goes through multiple revisions. So send it to your friends, send it to your family members, send it to people who know you and who do not know you as well. So your feedback will help you from people to see that the person you are is that what is reflected on the paper. And you want to be honest, and you want to be straightforward. You can't create stories there. You have to gather information from your life and apply it in your personal statement. So those are the 4 key components of your application. What also matters is your scholarly activity, whether you have participated in local, national, international conferences, if you have presented posters, if you have publications. And I'll be honest with you, it's very hard to be a medical student and publish as an international medical graduate, right? So especially I'm from India, and I can tell you I had no publications in my med school. That's not part of our training. Things might be changing now, the last 10 years, but conventionally we don't have a lot of publications. So that's okay. That's why I think programs filter based on all those 5 criteria. But I'm here and you are here, and we didn't have a lot of publications that many people do. So I don't want anyone to be thinking about it that I don't have publications, so I don't have a lot of chance of getting into US residency. So the goal is to get high scores. Everyone aims for high scores. I don't want anyone to ever take chances with their USMLE Step 2, especially now that Step 2 CK is the only one that has scores, since Step 1 is pass fail and CS is gone. So do the best you can for your CK, aim high, don't compromise, and get the best score possible. For a foreign medical graduate, truly scores matter.
One question I had for the CV, like when, let's say someone has gone through those electronic filters, which we know about, like scores, maybe medical school, and then you're looking at the CV, what kind of things should like an international medical graduate avoid, like maybe sounding arrogant? So
more than just reviewing CVs, I think I can tell you from mentoring over the last 10 years, medical students, and only and specifically international medical students that I can speak for is we don't realize that our CVs can come across as not genuine. And what do I mean by that? Many a times we do things in India, for example, if you're part of pulse polio immunization program where you did something, but it's not longitudinal. You did 1 day of work, and if you try to pad it with more information, it will come as not genuine. Okay, so I think when you are putting in the volunteer work, what you're looking for is, are you committed to that cause that you're volunteering your time and effort? Is this a longitudinal experience? Is this something that you truly care about? Otherwise, it does not look good on the CV. A 1 day volunteer activity is not something you want to put on your CV. What do you want to put on the CV? It's research experience. For example, if you even have a small case report, if you have a research project, it might not have gone through the publication stage because that takes time. But if you can meaningfully talk about that experience, what did you learn from that project? What did you learn from that case report? You can describe that instead of just writing that this is the project, I did data collection, and it's presented at this X, Y, and Z conference or a meeting. So what we really are looking for is the depth of your involvement in a project. And the final outcome is great if it is published, but what did you learn from this experience? What did you contribute in that project? That probably is more meaningful.
Do you also look at hobbies?
We do. I think putting that as a interest and hobbies, I think it's important because if you like documentaries and I like documentaries, it's a nice icebreaker to talk about it. It does not. I don't want anyone to over stress about some of these things, right? When I was in your shoes, I was like, man, should I write this? Will that be judged in a different light? We overthink this, and that's not the goal. Just be yourself. And um, if you like playing video games, if that's your interest, then sure, write that. If you like reading books, um, do that. But don't write "I like reading books" and then you can't talk about that during the interview properly, because that would be a red flag for me. That hey, you talk so much about how much you like photography, but you don't have any understanding of it, or you can't talk about it in a meaningful way, then that's again dishonest, right? So my advice throughout this will be absolutely be your genuine self and be honest and be truthful. And everything that you write on your CV, on your ERAS application, that's a fair game for anyone who's interviewing you to ask you questions about that. And the reason is that on the both sides, we're just having conversation, right? We have a lot of stress because um, there's a lot at stake, right? Your entire world revolves around getting interviews, and then you want to ace that interview. But what you don't want to be in a situation is um, you put it on your CV, and I ask you a question about it, and you can't talk about it in a smart and honest way. Then that's a problem. So you can write hobbies and your true hobbies.
Yeah.
Everyone loves traveling. Everyone loves food. I think everyone loves that. But what is unique that can stand out if it's your true passion that you really, really enjoy? For example, I know you love photography, and I love drone videos. That's what I make now. So if I write that, maybe that's something that's very personal. I like watching documentaries. Maybe that's something that interests someone else on the other side, and we can talk about it. And that's the goal of the hobbies and interest section. It's an icebreaker.
The next thing I wanted to talk about is personal statements. Like, what are the things which should IMG should avoid putting in personal statements?
Personal statements are personal, right? So it tells a story about who you are, right? There is very limited space. I don't think anyone should write more than one page of personal statement. What you want to convey through that statement is who you are, what do you value. At this point, we're not looking into why you went into med school, right? So that part is done. I think the goal of your personal statement for residency is that why do you want to do this particular residency? Why are you attracted to this field? What are some of the major events in the life that helped you make this decision? And it doesn't have to be heroic. It doesn't have to be transformative. Not everyone has won an Olympic gold and then decided to go to med school or residency. It's your story. What I advise students that I've mentored is just put your true self on the paper. I don't want you to try to fake it for any reason. So over exaggeration, just filling in information that does not reflect who you are is going to be the challenge. Um, Many people try to put in too many examples that I love internal medicine because I had this outstanding patient experience. Sure, that's potentially true, but is that one patient experience that transitioned you? Probably not, right? It's probably the breadth of what internal medicine offers to you. You love the continuity of care in the outpatient clinic. You love the patient relation that you develop in the clinic. You love the wards or the hospital ward care that you have received. You love the diverse kind of pathology that you see. That's all genuine, right? Like, and I don't think I will mind it if someone comes across in the personal statement, hey, he actually gets it. He's not or she's not trying to make it sound fancy, and it's true and it's genuine, and your love for the field kind of reflects. what you admired about the medicine as a med student when you work with the residents, when you work with the fellows, when you work with the attending? Did you find a role model fellow, role model resident, role model attending who inspired you that this is the kind of doctor I want to be? So all of that is fair. I just feel that when you try to put in too many examples, that's just waste of the real estate that's so limited in your personal statement. And again, I can tell you that as much as Arjun, you're putting me in that role that I know so much about it. I think I'm sharing my opinion, and someone else's opinion might be different. And I can only share what I I have experienced and the feedback that I've received from the students and many of my friends and colleagues who are in that position, what they share with me. So, be again, this goes back to the single most important principle is to be genuine, to be your honest self, and personal statement is actually very personal. So, spend time on that because that kind of sometimes separates you from everyone else.
So just be genuine and spend time and make sure it's a good reflection of who you are and why you choose the residency you're choosing.
Right, and and we have to be honest, right? When you and I were in India, we did not know where Wisconsin was, where Cleveland was, where Philadelphia was, where Alaska was, right? We know it on the geography map, we can find it, right? But we have not lived in these places. For us, our simple, honest goal is to come to the US to get the training we want, right? And it's fair. So you can't talk about I want to get residency in New York City because this is my dream city. You have not lived there. It can still be your dream city, but you don't know the good, bad, and the ugly of each city. So you can't customize a personal statement to that particular city or a hospital. I will give you an example that if you are someone who has gone through this rotation, right? Like for example, you did a rotation at Cleveland Clinic, you had an outstanding experience in ICU, your letters of recommendations were from the intensivist at Cleveland Clinic. So you can talk about it and you can talk about that experience that as a medical student in India, this is what I experienced. When I came to US and I was doing my sub-I at Cleveland Clinic, this is what I experienced. When I went to Mayo Clinic to do my research here, this is what I experienced. That's a powerful personal statement because it kind of gives me a picture about what you have done and what different lessons you have learned at different stages. So that's a very personal statement. That's Arjun's personal statement, right? And your experiences are highlighted in that personal statement. What mistake you can make in that is that you're trying to then cite your studies that you have done, the projects you have done. That's already given, unless you want to highlight that, well, when I was at Cleveland Clinic, I found this very challenging case. I loved how the team came around together, how what did you learn from that particular experience, and then it's also there as a case report in your scholarly section. Or you did not know research, and then your mentors took you under their wings and then taught you research methodology. As a result, you were able to generate X numbers of abstracts or something. That's a powerful personal statement. It reflects maturity, it reflects growth. What it does not reflect is that it's not a cookie cutter personal statement that you have to have X number of boxes. I want everyone to think about personal statement as, okay, I'm a physician at that point, right? In India, if you're finished with your med school, you're a physician. You can go and treat patients. Why you became a doctor is okay. It can be a one-liner. You don't need to spend a lot of time. Where do you want to go from there? Okay. What kind of physician you want to be? Where do you really see your future? And what do you need to become that physician in future? And that's your residency training and fellowship training. What kind of training environment you're looking for? Everyone aims and wants to go to the top most university program or a big name program. Does that mean that people who go to community programs don't get their goals? They do, right? So your training will impact your long-term goals. So what is it that you really want? If you want to be a good clinical physician, your community programs will train you and get you there. But if you want to do very competitive fellowship, if you want to have an absolute dedicated research academic career, then you need that support of mentors who are mostly available at bigger academic centers with funded research and a system in place to support you. So your personal statement can reflect that, and you need to spend time thinking about what you really want. Most of us, when we are in our 20s and we are straight out of med school, all we want is to come to US to do our residency and to become cardiologists, gastroenterologists, without even knowing what that really looks like in the US, right? So if you have experience in that, if you have done electives, if you have done observership, reflect on that and think about, do I really want that? If I do, then I should mention that in a very confident way.
Yeah, that just sums it up brilliant. Thank you for sharing all those insights. One thing I wanted to ask you is when you're interviewing someone, when you're judging a person, and I was one of the virtual applicants, so this is even more difficult. You're sitting in front of the camera, looking at the camera and speaking like we're doing right now. So what kind of things do you look for? I think virtual interviews are here to stay. So any red flags?
Well, virtual interviews are good in some ways. I truly feel bad for anyone who has to travel for each interview, right? And I was one of them, and I did it. And when you're converting your rupees into dollars and then traveling and taking flights that are $300-$400, and it's a painful experience. Then finding a hotel, and we don't have driver's license, and then taking a cab, all of that is it's painful. So there is a positive in that you can interview in many places and without it costing a lot. But the downside is that you don't get the culture of a place doing a virtual interview. So there is a downside to the applicant. And there's also downside to the program, because if you went to, for example, Mayo Clinic for interview, and if you only saw it virtually, sure, Mayo Clinic already has a name, Cleveland Clinic already has a huge name. But if you go there and you meet the people and you see how they work with each other, how they interact with each other, you get a sense of the culture in that place, right? So that's the disadvantage to the candidates. So to answer your question, what can a candidate do to make sure that their experience is genuine and positive? It's the connection that when you and I are talking, there's not a huge lag between our conversation. The conversation is flowing. It's harder for the candidate, to be honest. It's very hard to sit at one spot for like half the day or sometimes full day to put yourself in the best light possible. Answer the same question over and over again. It gets tiring. There are essentially no specific guides to tell you that we have to use a formula, but an eye-to-eye contact, we have to make sure that we can look at each other. So make sure your space is not crowded with the stuff. You have a quiet space to talk. Some of those basic etiquettes of Zoom and Microsoft Teams and all of those virtual platforms that we are using for interviews they apply in our real world life too. But it's just a conversation. Again, going back to, if you can hold a conversation, you take your time to answer a question, you don't just blurt out the first thought that comes to your mind. Those are simple rules that apply. I won't say there are any red flags. I mean, you and I might not connect, but that does not mean that the interview is going bad or anything. If I ask you a question and you don't have a good answer, that's okay. I think most people need to just think on their feet, take a deep breath, regroup, never panic. One answer is not a deal breaker. Okay. I can give you several examples from my own days when I interviewed. I felt like I won the interview because I answered one question completely. This was related to filariasis in India, and the physician who asked me this question, and I completely gave him the wrong kind of species that we see in India compared to what is seen in Africa. And then I came home, I looked it up, and then I realized, oh man, I messed up, and this is going to be bad because this was a big name researcher who contributed to DEC that we distribute in India, those tablets. So I sent him an email apologizing for my wrong answer, and then I got a most favorable email response that thank you for your scholarly pursuit and thanks for correcting both of us. And So, you know, again, being genuine about this probably helped, that I'm not trying to hide my weaknesses, and I messed up and I apologize and I corrected myself. And that's what the goal is. Residency and fellowship and attending, being a consultant, being a subspecialist, always being humble and being honest probably is your best friend. I think that advice, my advice to everyone, will forever stay true no matter who you become. So I don't think you need to overthink anything specific with interview. Take your time to answer. If you need to pause and reflect, and then say, okay, well, that's a good question. Let me think about it, and then that gives you time to process and then answer.
So now moving on to the fellowship application part, a lot of people have submitted their fellowship application literally yesterday, and how is it different from a residency application?
Right, so Arjun, I can tell you, fellowship has been my favorite part of my training, and the whole experience is rewarding. It's stressful. It's the same level of stress because you're again uncertain where life is going to take you, right? But you're choosing to do it. Your worst case scenario is that you will still be a physician in the US. You're still going to have a comfortable life. You'll make hundreds of thousands of dollars. So life is good. So always have to have that perspective that your worst case scenario is someone else's dream. So with that in mind, if you go through the application process, it's slightly different because your intern class, I mean, at clinic is really big, but at every program, at least there are 10 to 20 residents. And in fellowship, no matter which fellowship you do, the number is significantly smaller, right? So the program director, the associate program director, the division really works very closely with you. So they select their peers. That's what they're looking for, and they're very, very committed to your experience as a fellow.
Yeah.
So that makes a difference. So you are a good fit or not. That's the primary concern for every department, no matter which kind of fellowship you're planning to do. What they're looking for is you're trustworthy, you're nice, you're a good person to work with. Your work ethic has to reflect the culture that the program that you're going to join. So that's the difference between residency application and experience of interview versus fellowship. Because as a resident, what is the bare minimum requirement? That you're competent, you're good, you're professional, but you're not dealing with the leadership every day, right? But at the fellow level, you're looked at as part of the team, part of the leadership as well. So you are going to be a team leader, you're leading the residents, you're teaching the residents. So what you do reflects on the department, right? And you have had that experience that you work in different departments with different fellows. So uh, how you feel about the fellows is also how you feel about the department, because fellows become the face of the department for the residents, right? For the med students. So
Yeah.
so that experience changes how programs look at fellowship applicants. And the same policy, same principle hold true here too. Here, your scholarly activities carry a lot more weight, primarily for fellowship, because that shows your commitment to the field, that shows your drive to advance the science and to see what you can do for the program. Because this is more of a marriage, to be honest. Like the fellowship commitment is both ways. The program wants to get the best possible candidate, and they are also trying to get you there, right? Because if you are a good fit, you're going to make the program better. You're going to make the department proud by contributing, whether it's scholarly, whether it's teaching, whether it's clinical, all of that. So programs are trying to get the best candidates for themselves, which is different than residency, because residency, that the volume is enough for every program to get the candidates. The fellowship is a little different. It's relatively in your favor as a candidate, because if you are a strong candidate, then many programs want you. Whereas if you are applying as an international medical graduate for residency, they have a lot of people to pick from. So you don't have a lot of advantage there.
So something which you recently went through is a fellowship graduation. Congratulations again. So moving from fellowship to job, like how I know you made the most out of your fellowship, and Dr. Ashton, who is the program director of Pulmonary Critical Care, like mentioned this forever, the one who got away for Dr. Bhardwaj and Dr. Steve Fox, who went to UAB, two of my favorite fellows. So how do you make the most during your fellowship time so that you can like land at a job?
Right. So that's a great question. And again, there's no customized answer for that, because I can tell you, everyone has different interests, right? So your interest in fellowship is okay. At the end of 3 years, you will become a gastroenterologist, right? That's given. What do you do during those 3 years is absolutely up to you, because if you have, say, 6 fellows in your class, so those fellows have different interests. Someone might be interested in hepatology, someone might be interested in IBD, someone just want to be a clinician, a strong clinician, and the best clinician possible. So they don't need to have research focus. So all of that is what you want to be honest with yourself. You will have plenty of opportunities if you go to a program that has availability of all the different skill sets you can learn, right? You need to be very careful what you pick and choose, right? And don't lock yourself in. That's the most important thing that I can tell you, is that we have preconceived notions, right? Like most of us, when we grow up in India, we want to be cardiologists because that's the most prestigious thing, or a gastroenterologist. That's like, it's the hot thing to be. And we come to this country with that mindset, and we are locked in, but we don't know the ground realities. We don't know the lifestyle. We don't know the practical challenges of that field, or whether we like it for the right reason or not, right? So that's done. So you're done through the residency. Now you are committed to the field that you want, but within that field, we also already commit ourselves that I want IBD, I want hepatology, I want pulmonary hypertension, I want interventional cards. All of those things, again, don't lock yourself in early without truly having thought through it. So fellowship is a great time to explore. You should explore everything you want. Don't hesitate. Teach if you like teaching. Pursue research if you have never done that. You will find mentors. That's your time to do that, right? You have done some research, because it's kind of a requirement now to get into fellowship, right? So most of us have some scholarly projects and publications, but truly explore whatever your heart desires. If you are absolutely committed to a particular subspecialty within your field, then make sure you're a strong clinician first, and you're committed, and people like you for your clinical acumen, and then take a deep dive into that for those 2 years. But what I can tell you is that I have interviewed so many specialists for the podcast that I host, and everyone has told me that they were not committed to the specialist that they became. So if someone became a sarcoidosis expert or a pulmonary hypertension expert, it wasn't straight up in fellowship that they decided, and they had to get everything in the order before they graduate. Many of them, in fact, started their actual career that they're now known for years after their fellowship. So I had the same level of anxiety. That's why I was asking those questions that, hey, I have 3 years. How do I make the best out of it? And the advice that I received is like, take your time, enjoy the journey, do everything you want to, and everything will fall in place. So we are not in a rush to get things done. There is no award. Well, there are awards, there are academic awards, but there's truly no award in life to get somewhere fast. Okay. So my advice is during fellowship that enjoy, explore, talk to as many people as you can. You might not know what opportunities come through that, because you might find great mentors by just communicating and being a genuinely nice person that want to talk to people. You understand what they do. If it's of interest to you, give it a shot. If it doesn't work out, you know it's not for you, right? So exploring your time in fellowship is absolutely key. If you are committed, then do advanced training if you can. Get a master's in clinical research if that's something you think you want to do long term, to stay in academic career. In terms of how does that help in your job? So it again depends, right? The job opportunity in the US varies in terms of academic centers, right? So academic centers look for candidates to fill a particular need that their department has. It's not about you, it's about the department, right? They want you for a particular role. So if my department says that I need someone to handle all my CF patient or bronchiectasis patient, then that's what my department needs. I need that position to be filled by a clinician, right? But you come in with the expertise of pulmonary hypertension, that's not a good fit. So it's not about you or your candidacy, it's about what the department needs. But that does not mean that you won't have the PH need at another institute, right? So pursue what you like, do what you want, and be flexible. And I think I can tell you, I am exactly like the person you're describing who plans 5 years ahead, 10 years ahead, 2 years ahead, and we all do that. And then life happens. And I think learning to be flexible and learning to enjoy the journey is really important. I sound like an old man now that I'm advising all these philosophical things, but truly everything falls in place if you just enjoy the journey and you work hard and you do the best you can and not try to micromanage your life, because it will not work out that way. But whatever is good for you will happen. So enjoy the journey. Jobs will happen. Jobs, you'll get the job. You will get your dream job, and the dream job does not happen on day one. You have to hammer it out over a period of time. You have to customize it, and you might not get the most ideal job, but you can make it over a period of time when you work at it.
I think that's like very strong advice. As someone who will be applying to fellowship, I am worried whether I should be like thinking about hepatology versus pancreatology versus IBD. And day one, I don't even know how to like hold the colonoscope. So
right.
yeah,
It's too early. It's okay. I think we have some idea because we have mentors and we want to be like them because we admire them for the work they have done, how they have treated others, and how they treated you. So we develop a passion for that field. For example, I love cardiac arrest research, right? Because it's my mentor, Ben Avila, who's the kind of person I want to be. And so I'm committed to that field because I found a mentor that I could try to kind of make my role model and to learn from. And I found clinicians at Cleveland Clinic that I admire so much that these are the kind of pulmonologists, the intensivists that I want to become. And so you learn from your experiences, right? And it's okay. You might like something already because you have had that experience. But without that experience, I think it's too premature to say that I want to be interventional cardiologist because that's what I want to do. But you have not been to a cath lab, right? So what else did you have in mind?
Yeah, the next like moving from like job, I would ask you about like financial advice, like as someone coming in from a different country and like totally starting from scratch here. During residency, you get paid money. Money is probably enough to kind of survive, but long-term planning for like 5-10 years.
Right. I think I'm a very simple person, and my simple advice is to live absolutely within your means. That's the number one advice I can give you. And the best advice I received during my second year of residency. So I went and I was in the office of a rheumatologist who asked me, do you submit or do you contribute to 403 or a 401k? And I was like, what are those? Right. So if you're coming from India, you have zero idea about what is retirement funding here, right? Mm-hmm. So most institutes during residency contribute to your retirement. You absolutely need to learn that on day one of residency and ask your HR, tell me what my retirement contribution is, how much does the hospital contribute, how much does the hospital match, and how much can I contribute? And absolutely do the maximum match that the hospital does. That's your absolute bare minimum you should be contributing, because there's compound interest over a period of several years. I did not know any of that, right? I still don't have a very sound understanding of finances, but I can tell you that that single advice has helped me with thousands of dollars. And the doctor actually, Dr. Bergman, he told me that start contributing the maximum that your hospital matches, and you can thank me several decades later. And it's true, because those small paychecks that you add to your retirement funds early on during your intern year and residency year They're not a lot of money that you're missing. That's not a lot of money you're missing on your per paycheck, but as it accumulates over several years and several decades, it will become a lot of money. So that's my single advice is contribute to your retirement plan right on from day one. And if your program does not match, that's okay. And if your program does not have a retirement plan, you can still contribute up to X amount of money per year. So ask your colleagues, ask your friends, and have that important conversation early on. Even if you're single, you're carefree, you don't have responsibilities, I think that's a smart financial move to contribute to your retirement early on because there's no pension plans here, right? So
Yeah.
you have to have retirement. With regards to cars and housing and stuff, live within your means. If you're really someone who loves car, right? Sure, buy it. Get some fancy car that you want. But if you can hold off till you become an attending, and even the advice that goes is that for the first few years as an attending, if you can live at a fellows and a resident lifestyle, you are better off financially long term. And I'm not saying that this is delayed gratification that you can then drive a very fancy car in your 60s after retirement. The goal is that
Mhm.
the first 5, 6 years, when you come from India or we come from other country, you're starting to develop roots. You don't have credit history here. Your interest rate will be very high. So you don't want to spend money in interest. That's a waste. I remember getting a secondhand car, and it was shocking because when I went to the credit union, they said, I asked for a $10,000 loan, and they said, yeah, your loan is approved for $1,500. And I was like, I needed 10,000. They're like, you don't have credit history, so we can't give you more than 1,500. Well, then I went to bank and they said, well, because you don't have a credit history, we'll give you $10,000, but we'll give you an interest rate of 10%. So that sounds outrageous, right?
Yeah.
Now your interest rate is 2% or 2.9%. So paying 10% interest, that's too much. So minimize your unnecessary expenses with interest. Buy a trustworthy used car if you can. Live the way you want to live. I can't advise you how to live your life, but live within your means for the first few years till you understand the system, till you know where your financial stability is, and put in some money for retirement early on.
One thing I would like to ask you before I end this video is as a foreign medical student who's in a
Mhm.
different country who might be watching this video is kind of targeted towards people who would be applying and then also medical students, like who is sitting in a different country, kind of dreaming of coming to the United States. Maybe what I used to do maybe 5 years back, I'm watching this video. What can I do as a medical student in a different country to set myself apart?
Right. So I think it all depends on your med school. I think that becomes a limiting factor. We all plan ahead. Um, the most important thing you can do is primarily reach out within your med school to professors who are academically driven, because I think the challenge is that scores, personal statement, your med school name, a lot of those things you can't change eventually. But while you still have time, you might find people within the department that you have access to who are doing some of these research in your home country. It doesn't have to be outstanding and publication, but you contribute, you get involved. Writing case reports is probably the easiest thing you can do. Presenting those interesting cases at local meetings is really a low-hanging fruit, which I was not made aware of when I was a med student. If someone told me that this carries weight and I should explore that opportunity, and it starts the process of how to think about a challenging case, how to do some literature review, how to then put it all together and go and present at a meeting. We all do that. At the day you hit internship, you're doing that here, right? The day you are a resident, you're doing it here. And suddenly you are able to write so many abstracts. How is that true? It's because here you have a structure that someone is given to you as a mentor and you're able to do it. But in your med school, you have to find those people. And it's happening. It's not like US is special when it comes to research and publications. Your med school did it. My med school, a lot of professors and assistant professors and associate professors do high quality research and they publish, but they are in departments that we don't usually go to and we don't have access to. So reaching out to people, talking to residents and fellows in your own hospitals who are involved. So you realize that, right? Every single postgraduate in India writes a thesis. They
Mm-hmm.
work on research projects. They that's their requirement to graduate from their MD, right? So reach out to them. Hey, what are you working on? How can I help you? And then see if they can get you involved in their thesis, and you can do some data collection for them or data analysis. Or if you are very driven and if you have time, then doing courses on learning biostatistics and maybe R. That's too ambitious, but because you have other responsibilities and you don't have that much time. But
Mm-hmm.
there are low-hanging fruits. Case reports and being involved in someone else's project to learn the process is probably something you can do easily. One other thing I was doing electives. You have to plan your electives way in advance. I think step one score and step two CK scores were very, very crucial in getting a lot of foreign medical graduates. That was a kind of a equalizer that if you get really high step one, step two scores, then you were at least in a better position to land an interview. With step one score being pass fail, the programs don't have that many objective criteria. So I think it's even more important to do electives, and it's can't get elective for any reason, especially with the COVID that has been so bad for multiple reasons, but especially for foreign medical graduates not able to do these electives and rotations, observerships, and those are some of the ways to do it. You have to get US clinical letters of recommendations because um, it's unfortunate, but that's the reality that the letters of recommendations carry a lot of weight if they are from US physicians, from university program, from community hospital, from offices. There is a lot of weight to that. So start planning for electives, observerships early on, and you don't want to be in a situation where you start so late that you have lost the window.
Yeah, that's like exceptionally strong advice, I would say. Yeah, like starting like early, especially during your second year, if someone is watching during their first year, like find opportunities to like do electives or like visiting rotations in the United States. It's something which is becoming like more essential day by day since step one is pass and fail. And then the other thing which Avi said, and this is which I am guilty of. Like I did not get like opportunities to present at local meetings, but I'm aware that these things happen, and the other people who have connected with throughout the years have told me to do the same. And that's like those are like low hanging fruits, like case reports. It doesn't take a lot of time, and then there are postgraduate students like in internal medicine departments, sometimes community medicine departments, pediatrics, who you can reach out to for the case reports or like longitudinal studies. So these are some things which can be done from your own country even before you like step foot in the US.
Right, Arjun. Yeah, and I think I'm glad you're doing what you're doing because one of the things that I want people to realize is that um, when you come to US as a foreign medical graduate, you represent yourself and you represent your med school and you represent your country in a way too. I don't think everyone realizes that or wants to take the sense of that responsibility that I'm representing my med school. But if you do well in your residency, it opens up the door for the next person from your med school, the next person from your country, because it's very obvious that if a particular student who's now transitioned into an intern is doing very well and everyone is like, wow, this person is solid, then the next applicant from the same med school gets looked in very positive light that, oh, this person is from the same med school as Arjun or Abhi, and then we have had great experience with these two people, then perhaps that opens up the opportunity for the next person. So one thing that I really, really want to highlight is that this is not the end. This is not the destination is to get into residency. That's just the beginning of your 30, 40 years career, and how you carry yourself during your residency, during your fellowship matters. It matters not just for you, but it matters for everyone behind you and after you as well. So do the best you can. Don't settle once you reach your destination, because it truly is not a destination. It's just a journey, and then pay it forward. I think what you are doing, Arjun, is very commendable, that you are putting this out for someone else. So they might benefit from your experience, my experience, and this might help someone else.
Yeah, that's the goal. Like the way you have helped me, the way others have helped me throughout my like 5-6 years of journey, even before I landed into residency. I think we can like only help each other to like grow and move forward. That being said, any other parting advice which you have like recently got? Like moving from Cleveland to California must have been like really difficult, but
Yeah, yeah, it's a journey, man. I think we just have to do the best we can, and enjoy the process, and be flexible, and make good friends during residency, during fellowship, because you go through a shared experience, and it's traumatic, it's hard, and it's very labor intensive. I have fond memories of my time from residency and fellowship, even though those were longer hours. But you're going through this experience as a group, so it makes it easier. Always help, always try to make it easier for someone else. Always give benefit of doubt to others, because you don't know what someone else is going through. People who are short with you, their temper, uh, it's okay. I don't think they mean it, unless they are really bad people. Then that's a different thing. But most people mean well. They try to do things uh, right, and I think just giving people benefit of doubt, being kind, and being more forgiving goes a long way than holding grudges and being self-centered. I think the more altruistic you are, the more you will receive. So it's not selfish, but just help as many people as you can, and then you will see that a lot more help comes your way.
thank you for joining me. And I think it's what, like almost 3 hours behind
Yeah,
like Eastern time. What's the time difference? Like, what's the time there right
three
now?
hours. Yeah, it's
Yeah.
4:45.
Oh
So
wow. So you just got done with the clinic.
yes, yes, yes.
Nice. Super. So where can people find you?
Well, I'm on Twitter. I'm on LinkedIn. I'm also on Instagram, but Instagram is personal, so I don't post anything professional there. But professionally, if anyone needs to reach out to me, I can, like, if you want, I can share. You can share my email.
I can
And
put it in the description.
okay, so Twitter, LinkedIn, Gmail, whatever I can do to help someone, happy to do that.
Awesome. I cannot thank you enough for what you have done for me, both from a personal and from a professional standpoint. I don't think I would have made it to Cleveland Clinic unless I like you were there
No,
for me, I guess.
you're too kind. You're too kind, but you deserve it, Arjun. And I can't wait to see your journey as a future gastroenterologist. You're a good person, and you work hard, and you're an honest person. I think those are the characters that everyone looks for. So keep up the good work, and all the best for your fellowship. And if you come to California for interview, you will always have a home here.
Perfect. Yeah, I would love to, like, especially during December months, maybe visit you for some sun. It doesn't get like too sunny in Cleveland, but anyway, with
Yes.
that, I would like to end this video, and it was a pleasure having you.
Thanks, Arjun. Thanks for doing this.
Perfect.